Namaskaram. I am Dr. Mary Iype. I am Senior Consultant Pediatric Neurologist at PRS Hospital, Trivandrum. I was former Professor and Head of the Department of Pediatric Neurology at Government Medical College, Trivandrum. Today, I've been invited to talk about, is epilepsy curable? Can a patient with epilepsy lead a normal life? Since I'm a pediatric neurologist, I will confine myself to pediatric epilepsy. Pediatric epilepsy is so diverse. We have very benign epilepsies and very malignant ones too. When you talk about the benign epilepsies, one thinks about absence epilepsy in children first. These children have episodes where they go into absences, they look up for a second, the eyelids flutter. And this is a very benign, very treatable epilepsy. 80 to 90% of these children are curable. You give a very simple drug called sodium valproate, and sometimes you need a drug called ethosuximide. 80 to 90% of these children will be cured. There are other benign epilepsies, which we call select now, where you have a focal epilepsy during sleep. And here also, this epilepsy will remit by 15 years of age. Yet today, we recognize that some of these children may have learning disability. Some of these children may turn out to have intractable epilepsy. So we treat all of them, and they have a very good outcome. Whereas there are other malignant seizures in childhood which do not remit. You may have focal seizures that are easy to treat with drugs called carbamazepine or oxcarbazepine, and genetic generalized epilepsy, some of which also remit with sodium valproate. But many epilepsy may not remit like that. Focal epilepsies which do not remit with drugs need surgery, which is available in select centers in the country. If genetic generalized epilepsies do not remit with one drug, we will go on to 2, 3, or 4 multi-drug combinations. And with this, we can cure many of these children. However, some of them may not be curable. For them, we have ketogenic diet, where you give a diet where there's a lot of fat and protein and little or no carbohydrate. So that they develop ketosis, and by a mechanism that is still not exactly clear, the seizures get controlled. In the newborn period also, you can have seizures. Genetic seizures in the newborn period can be very benign epilepsies for neonate, or it can be catastrophic. The benign neonatal epilepsies remit on their own in a few days' time, but the catastrophic ones continue. And you know that the catastrophic epilepsies of the neonate will have an underlying cause, usually an inborn error of metabolism or a brain malformation. Such children, whatever you do, they will not get cured usually. It is very infrequently that you can control the seizures, but the child will be usually cognitively very bad. So also in infancy, you have a seizure called infantile spasms, where the child does not have tonic-clonic seizures like that. It is a salam seizure like that. This may not be recognized by the parents or by the pediatrician, but this is a very intractable epilepsy. You have to give drugs called ACTH or vigabatrin, both of which cause cure in a large number of children, but there is a sizable number who never get cured. Even if the seizures remit, you find that the child is cognitively abnormal and has motor deficit. So in infancy, you have other benign epilepsies which can be cured. And beyond infancy, again, you have many genetic epilepsies that could be either benign or malignant. And the malignant epilepsies are fewer than the benign ones in this age group. And when a child has epilepsy, you have to think that the child is having a benign epilepsy, try to treat end of your capability, and many of these children become normal. They are able to study well and live a normal life. Only when you prove to yourself that with your single drug or a combination of drugs or with ketogenic diet, you are not able to control the epilepsy, then only you label the child as intractable and needing special care. And epilepsy surgery also cures the epilepsy in the majority of children who undergo surgery. Compared to adults, surgery in children is more effective for focal epilepsy. In children with focal epilepsy, you find what is called hippocampal sclerosis, and the hippocampus is removed during a temporal lobectomy, and this is how the seizure gets cured.